When you work in such conditions of abject poverty, your ideological moorings are bound to be different. You're obviously going to be extremely critical of the role of the government or the private sector in the healthcare system. These doctors are daily dealing with the problems of malnutrition and are left wondering if the food insecurity problem will ever be solved. So they have now begun questioning if the rising Sensex of the fancy economic growth rate makes any sense to those who are looking to a healthy village road or have never experienced electricity in their lives.
130, 140 हमारे पास छोटे बड़े प्लांट मिला के सेल को लें, जिंदल को लें, भूषण को, बाकी लोग जो आ रहे हैं पुराने जो काम कर रहे हैं, स्टील में तो बहुत बड़ा एरिया है जो काम कर रहा है. टाटा भी इच्छुक है आने का, एसआर भी इच्छुक है आने का.
But the state cannot hide its abysmally poor development data. It has a high infant mortality rate of 78 per thousand live births. The rural infant mortality rate is even higher at 95 per thousand. And the healthcare system is in a shambles. The state has just 6 district hospitals and merely 512 primary healthcare centres. South of Bilaspur, districts like Dantewara and Bastar have been taken over by the armed revolutionaries. In fact, the figures suggest that in the absence of these doctors, the lacunae in the system would have been even more glaring.
In fact, we find medical poverty as a major issue. People getting poor due to the fact that they have to seek health care at exorbitant rates. And this has also led to this, that there are a large number of people who do not seek health care anywhere because this cannot afford to do.
Therefore, it's only to be expected that the doctors will harbour strong views on claims being made that liberalization has achieved miracles.
Probably the urban middle class has benefited, but the rural, we have reasons to feel that the nutrition levels and the financial situation of most of the rural Indian people has probably gone down in the last 10 years or so.
So given this grim scenario, the doctors are chipping in with whatever they can, like making drugs available at affordable rates. Cheaper medicine sold from the pharmacy bring people from far-flung areas to Ganyari. And it is because he now has easier access to insulin shots that Sufal has managed to survive. He is an acute diabetic and his helpless parents relied on fate alone before Sufal decided that a 30-kilometer weekly journey to Ganyari is the best option. And these 3 young people have heart problems. Their valves are defective. Their condition explodes the myth that cardiovascular problems or blood sugar are always urban problems.
Rheumatic heart disease is a life-threatening disease, cardiac disease, which affects mainly the young in India, mainly the poor, and because of the way our population is distributed, mainly people in rural areas.
This 13-bed ward is a fair indication of the kind of diseases they have to deal with in the countryside of the new millennium. This is a full-blown AIDS case. He's a migrant worker who has returned from a big city with the disease and may have passed on the virus to his wife. And close by, this 15-year-old mother is nursing her infant. The doctors say the policy planners don't understand that there is nothing called a rural or an urban ailment.
It's not that the problems in rural areas are different from those in big cities. The same kind of problems are there. Plus, malnutrition-related problems are much. The conditions are depressing, but doctors have not given up hope. There are moments like this with a bonfire in the evening when the doctors and their staff come together to celebrate. Every day is a grim day. Every day is a fight to save lives. So they must celebrate their bonding, celebrate their staying together, celebrate that there are others who are being inspired and joining their ranks.
This fire is not just about fun, though moments like this help lighten up a long journey in which many others have joined in. This fire is also symbolic of the will to carry on.
In fact, the doctors have turned creative. With help of colleagues from Delhi, they are designing the poor man's medical equipment. This electrophoresis apparatus, which separates sickle cells, has been developed in Chhattisgarh in the back of the beyond.
It has been developed because the branded separator available in the market is too expensive.
The entire thing we have sold to many non-profit organizations for 3,500 rupees. Keeping a market price, electrophoresis equipment you don't get in the market for less than 35,000 rupees. With an aluminum cap with a
Not just this. This water testing kit, another of JS's innovations, costs 5 times less than the market price. This is a double stethoscope, which is put to wonderful use while training semi-literate health workers. Of course, what really stands out is the community health scheme. Meet Kumara Devi. She has been taught to read and write. And here in a remote village on the edges of the forest in Chhattisgarh, she knows how to make a blood smear, wrap it hygienically, and send it to Ganiari through a relay system. A local boy carries it to the bus stop. The bus driver takes it to a dhaba close to the hospital, and there is a hospital hand who picks up the sample. The report is sent back the same way.
If we were to decide on a minimum level of literacy as a selection criteria, we would have almost eliminated the chances for a poor woman who would otherwise be socially most appropriate to look after healthcare needs of a poor community.